Hello. This is the recovery phase proposal for Angalci, which will run over the course of 6 months from October 2019 to April 2020. The background of the situation is that Angalci is currently facing a prolonged drought. Climate forecasts show an increasing trend in daily temperature and a decreasing trend in days with rain, which will exacerbate the severity of future droughts. Other socio-political issues include the local and international displacement of people and refugees, which result in border security problems. These issues result in food insecurity, health concerns, and hygiene and sanitation issues. For our theory of change, the overall impact our project aims for is to increase community resiliency, especially in the vulnerable populations such as women and children. This will be achieved through improving maternal and infant health, realizing food security, and decrease waterborne and hygiene-related diseases. Regarding health, in order to improve maternal, child, and infant health, our organization will address three concerns: access to skilled birth attendants, increased utilization of maternal and newborn health services, and decrease incidence of vaccine-preventable diseases. In order to increase access to skilled birth attendants, the project will educate and train skilled birth attendants, not only from the healthcare sector, but will include traditional and cultural health providers. In order to increase utilization of maternal and newborn health services, the project will implement active community health education programs. And in order to decrease the incidence of vaccine-preventable diseases, the project will implement immunization and vaccination campaigns. By achieving these activities, the project hopes to decrease maternal, child, and infant mortality rates by 25% in the long term. The short-term goals are to have one skilled birth attendant per health facility, to increase the rate of health service utilization by 60%, and to have a 95% immunization coverage in the target population. Regarding food and nutrition, in order to realize food security for each household of Angalci, our organization will address three concerns: food availability, food access, and food utilization. In order to increase food availability, the project will educate the community on drought-resistant crops and provide voluntary family planning programs. In order to increase food access, the project will support the empowerment of women, which will increase their income and increase dietary diversity. In order to increase food utilization, the project will provide micronutrient sachets and educate the community on nutrition and care practices. By achieving these activities, the project hopes to have 0% of the population falling below IPC level 3 and decrease the population currently at IPC 2 by 20%. The short-term goals are to have 60% of households with an acceptable food consumption score, a minimum dietary diversity score of 30%, and decrease the prevalence of stunting and wasting in children, as well as have 0 cases of anemia or scurvy in the population. In terms of hygiene and sanitation, in order to decrease waterborne and hygiene-related disease incidence, our organization will address three concerns: hygiene promotion, menstrual hygiene management, and excreta management infrastructure and education. In order to promote hygiene, the project will distribute hygiene kits that will last for 6 months, which will also contain education. Also, distribute education materials on hygienic breastfeeding practices to mothers with infants less than 6 months of age. In order to increase menstrual hygiene management, the project will distribute menstrual hygiene kits, which will also contain education. And in order to increase excreta management, infrastructure, and education, the project will build more pit latrines equipped with adequate basins, lighting, and locks. By achieving these activities, the project hopes to decrease waterborne and hygiene-related diseases by 60%. The short-term goals are for 60% of the population to use hand-washing stations, for 80% of households to have soap for hand washing, for 60% of women and girls of menstruating age to have the appropriate materials for menstrual hygiene management, and 75% of latrines to have adequate locks, basins, and lighting. In conclusion, our organization believes that these activities and goals can be achieved within 6 months. We hereby request the necessary funds to address the priority issues discussed and enable Angalci to recover from disaster. Thank you.